speak a little bit and have some of her workers here with her speak and tell you. She's got some interesting things to tell you. Go ahead.
Thank you, Bonnie.
Yes.
Thank you all for coming and supporting us today. We are new to the area. We are a home health agency, which means that we have the nurses that go out into the field and help the patients that need home health, like after surgery, or if they need help with fall prevention or physical therapy. People that are homebound, it's usually seniors, and we go into the home and help them with these. We have 72 offices all over 4 different states, and we have a very large service area with having 72 offices. With that said, this is Heather Chambers. She's our Director of Nurses. And this is Stacy Dix. She is the other area manager that's in the Nacogdoches office, and this is Kim Russell. And
she keeps us all in line.
Yes, she does. She does everything for us.
Mama Kim.
Yes. Is there anything else you'd like to say?
We are a Christian-based home health agency. We're #1 in patient outcomes in Texas and Oklahoma. That means that we are the best at taking care of our patients and getting them back to their highest level of functionality, returning them back to their daily lives. That's truly our goal. We have been open since March 1st of 2010 in Nacogdoches, and are proud to welcome Joy to our team expanding to the Lufkin area. So we're just very excited to be a part of this community. We actually had a gap in our coverage area between Tyler and Houston, and our physicians in those regions were accustomed to our level of care. It is superb, and so we opened an office in this region and also in Livingston in order to fulfill the gap in our coverage area that we had. We have discharged over 150 patients in the last year because they've met their goals. That's a very, very good thing if you know anything about the medical field. We've helped that many patients return back to their daily activities without any steps backwards. So we're very proud to be a part of this community. Thank you all very much. And anything else, ladies? Would y'all like
I would just like to say, when she's talking about discharging, you know, that they've met the goals and everything, that says a lot to me, because they're, you know, when we go in, when the nurses go in, they set the goals of what, you know, the patients need to meet, and then once those goals are met, we discharge them. There's none of this getting them on and keeping them on home health care forever. So that says a lot to us, you know, because there is a lot of abuse in the system. So we're very proud of that.
Anybody else have any questions they might want to ask?
I do. Well, so do you, home health agencies, I know, help people rehab and recover from surgery and everything, but do you all do something different as far as, are you more specialized in like hip replacements?
We do a lot of things differently.
Okay.
For one, we have more sophisticated technology than any other agencies that you're going to see locally. We actually own a software company called Home Care Home Base. We sell that to other hospice and home health agencies and reserve particular rights for Encompass because we own both of those organizations. Because of that, we're able to offer a physician web portal, which is an online access for local physicians to be able to log in at any time 24 hours a day and see anything. With our technology, all of our clinicians utilize a handheld device in the home. There are 12 screens that they must complete, so every clinician that's in the home does a head-to-toe assessment every visit for those patients. All of that information is funneled back into our web portal. The physicians can see labs the minute that we get them. We chart and graph patients' vital signs for the physicians to track for the entire home health episode, where typically a physician is only going to be able to access the most recent paperwork that they're able to find, or the last blood pressure or blood sugar from a visit that was in the doctor's office 6 weeks ago. With our system, they can log in and have a history charted and graphed for them of what the patient's vitals have been or labs have been throughout the entire home health episode. Our coverage area is another huge advantage. We don't really have a gap in coverage area in the north to
Bryan, Texas.
central Texas.
We're working on that.
Yes, and so we have a very large coverage area. So people who are residents in this area who travel to Houston or Tyler to have surgeries done or to have medical care can still receive an extremely high level of follow-up and skilled nursing physical therapy at home. We also have a list of specialty programs that are a mile long. All of our specialty programs are outcomes-based, evidence-proved. We don't just say, we're going to do a better job with your patients and take care of them. We actually track that, and we have reports and charts and graphs and data that's collected every visit that goes into a very technologically savvy system that's way beyond me to produce reports and report cards for physicians so that they can monitor.
And I think more of that is geared towards the therapy outcomes. A lot of the other agencies in the area have those outcomes-based objectives set with their nursing. However, physical therapy, occupational therapy, speech therapy have never really been outcome-based before until Encompass has come into play in this area. So instead of saying that our goal for this patient is to walk, from 10 feet to 20 feet, and that be the only goal set, it's, are you reducing their pain when they're walking? Is their pain being reduced over the 24-hour period? Are they doing their home exercise programs? Is their level of exertion and dyspnea or difficulty breathing while they're doing or performing those exercises also going down? Our clinicians, as far as the therapists, are also educated at our Dallas office at our Encompass Development Center, where we send all of our clinical staff for continuing education. So I don't know of very many therapists or speech pathologists or whatnot that are familiar with heart sounds and lung sounds, but we continually are educating our staff because the medical field or the medical, whole entire industry is changing so rapidly, and we have to stay on top of that and foresee the changes that are coming and have the best clinicians on board. So we want those physical therapists that aren't intimidated by listening to heart and lung sounds. And if they hear something that's abnormal or that they're not familiar with, then that's when they call the nursing in. So, and our communication within disciplines is extremely, extremely good, where you do not get that with a lot of other agencies. And we have full house in-house therapy, so we don't really have to contract out, which is different as well.
That's a huge advantage for us. Typically, we're able to have a physical therapist in the home within 24 to 48 hours post-discharge of a patient's hospitalization. With other agencies, it can be up to a week, sometimes longer. I also mentioned that we're a Christian-based home health agency. I'd like to touch on Encompass Cares. Our organization has a nonprofit agency that's funded by Encompass employees. We utilize those funds to provide medical mission trips for our employees to travel all over the world. We completed about 70 of those last year. We also use those for indigent patient funds. We had a patient whose front door was literally falling off of the hinges. It was not safe for that patient to remain home. The nurse applied for a grant through the Encompass Cares Foundation, and the Encompass Cares replaced the patient's front door. We've replaced roofs. We've done prescription assistance. We also utilize that for employee emergency relief funds for our employees, and also for community events. We have participated in 2 already this year, $1,000 grants for nonprofit agencies to assist them with community activities and events. So we're very, very proud to be able to offer that to our communities, and very proud we all contribute to Encompass Cares. And for an agency to really put that out there for any organization, not just home health, but for a business to really put that out there and say, we are a better way to care. That's our entire mission statement. And it doesn't just refer to our patients, it refers to our employees, it refers to our communities, to our referral sources. So that's our main goal, is to provide a better way to care for all of the entities that we are a part of.
So, and if y'all have any events that are coming up, if y'all will let Joy know, because we have not hit our goal for the year as far as
community involvement that we wanted to participate in with Encompass Cares. That was one of the goals that we had set for ourselves after our initial year, and as we've spread out to participate more in Encompass Cares Foundation since we're already contributing. So
That's awesome. We thank you. We thank you. Are we ready to cut a ribbon?
thank you for having us.
Spring snows have drifted into April. They say it might snow into May. There's nothing